Welcome to your pre-class content for your first week of your Lamaze series. My name is Kim James, and I'll be your instructor. Let's look at the events of late pregnancy that help prepare a baby's and mother's body for labor. 6 to 8 weeks before labor, key physical changes take place in mother, baby, and the placenta to ensure baby and mother are ready for efficient, healthy birth at just the right time. These changes are hormonally driven through chemical signals passed between mother and baby through the placenta. The timing of labor is usually perfect, and it starts sometime between 38 and 42 weeks. We want labor to start on its own because spontaneous labor is the best predictor of a healthy baby and an efficient labor that doesn't require medical assistance. Let's look at the important developments in baby, mother, and the uterus. A woman's body, placenta, and baby all work in harmony. A change in one causes a change in the other, and birth takes place when a baby is ready to thrive outside her mother's body, when the placenta changes from sustaining pregnancy to preparing mother and baby for the physical demands of birth, and when the uterus is ready to expel baby. Now we're going to look at the important developments in your baby that happen the last weeks of pregnancy. There is strong evidence that your baby is the one who actually starts the chain of events leading to labor and birth by releasing cortico-releasing hormone. That hormone begins the final lung maturation process. Your baby's lungs and brain are among the very last organs to develop. In fact, at 35 weeks, the brain is only 2/3 the size it'll be at birth. In the last weeks of pregnancy, the placenta and membranes become more porous and they begin letting through larger molecules. That means your baby is going to gain maternal immunities and enough iron to last for about 6 months after the birth. Baby also gains brown fat on their neck, shoulders, and back, and that fat is specific and important for temperature regulation outside the womb. Your baby's suck-swallow reflexes will be fully developed for efficient nursing, and babies who are born on time, and that means around 40 weeks and weighing around 8 pounds, have the lowest infant mortality for the first year of life. Now, let's look at the important developments in a birthing parent's body that help contribute to the most efficient and healthy labor and birth. The uterus gets ready for labor by increasing the number and thickness of muscle fibers around and on top of the uterus. It does that through on and off contractions called Braxton Hicks contractions. Expect more of these types of on and off contractions the closer you get to labor. In late pregnancy, a woman begins producing more colostrum around the time her baby starts to mature those suck-swallow reflexes. Colostrum is your baby's first food, and it's the precursor to mature breast milk. You may find a new intensity to your emotions, both high and low. The nesting urge, which is caused by that cortico-releasing hormone that's maturing your baby's lungs, it can drive you to feather your nest and get your environment ready for baby. Let's look at some of the specific changes to soft tissue and hard bone that make labor efficient. As your baby matures, she'll tell the placenta to make more prostaglandins, a hormone that causes the bottom part of the uterus to soften. The cervix gets very soft and mushy towards the end of pregnancy. That important chemical process allows the cervix to open more easily. Besides getting soft, the cervix also needs to thin. The thinner the cervix at the time of labor, the easier and quicker it'll be to open. Thinning starts well before labor, and it's the primary work of pre-labor and early labor contractions. The cervix may even open just a bit in the last weeks of pregnancy. In this picture, you're seeing a cervix that is long and thick and not open on the left. And on the right, the cervix has thinned out and is beginning to open. That shiny thing that you see in the middle, that's baby's amniotic sac filled with amniotic fluid. And baby's inside that sac with the head just behind it. Finally, the cervix will move from a posterior position, which means it points towards the back of a woman's body, to the anterior position, pointing more towards the front of the woman's body. That helps the cervix line up with the vagina for an easier passage. Now we're going to look at some of the hard bone changes that need to happen. Women's ovaries produce relaxin, a hormone that relaxes and loosens a woman's joints. Loosening of the pelvic joint specifically allows baby to descend deeply into a woman's pelvis. When that happens, pregnant parents will experience more of the classic complaints of late pregnancy: increased urination and lighter, interrupted sleep. Finally, the placenta begins making connexin, a hormone that helps the uterus contract in a coordinated way. In late pregnancy and early labor, those coordinated contractions will help baby find the perfect fit. Think of putting a key into a lock and wiggling it to get it fit just right. Baby will tuck their chin, descend further into the pelvis, and rotate to find that perfect fit. Let's look at the key developments for the healthiest baby and mother and childbirth. First, full maturation of baby's lungs, brain, and suck-swallow reflexes, and the ability to control their temperature outside the womb. Full transition of mother's soft tissues and hard bones. That includes the cervix getting soft and very ripe, the cervix thinning out or effacing. The cervix may even open just a bit. The cervix will move forward. And finally, baby will descend and rotate in the pelvis. Thanks so much for watching, and I'm looking forward to meeting you in class.